Hello, everyone, and welcome to a new session with Rights and Responsibilities Awareness Initiative. Today, we have Ernest Johansson, a mental health expert, to talk to us about depression. Important topic, a lot of consequences, stuff that we need to be aware of. Therefore, thank you so much, Ernest, for dedicating this time for us today.
Thank you for having me, and I feel incredibly passionate about mental health and issues arising from mental health and surrounding mental health. So I'm very happy to talk about anything related to mental health. So yes, depression. Now, depression is often highly stigmatized because people will just see it as excessive sadness or someone needs to kind of kick themselves in the butt and go out and do something. And while being active and engaging in the world is antithetical to depressive features, it's not a cure. And it's certainly, there's this moralizing of depression that occurs when, people pursue dialogue such as, you need to kick yourself in the butt and get outside or what have you. And the reality is it's not that simple. Now, a preface that I think is a responsible one to give prior to engaging with any discussion about any sort of mental health condition or disorder is that almost all mental health conditions are an extension of normal human behavior and normal human thought process. There are times when you are going to feel down, sad, depressed, even death of a loved one, a difficult transition, even if it's a good transition, like moving to a nicer house, you're still abandoning or leaving or losing relationships you may have had to the physical environment, to people, or the house itself in the old house. And that makes one feel down. That is a normal human feeling. Death of a loved one, as mentioned, of course, if you have any sort of relationship that now ends, it can be changing a job. Even if you're moving up in the world, there are going to be things you miss. So feeling down or depressed or sad is a normal part of the human condition. And in general, depression is defined as that state that causes you to withdraw, causes you to disengage, causes you to not have interest in activities that you previously would have liked for an extended period of time in some variants, such that it impacts your life. That is clinical depression. And there are there are different types of depression that, well, to backtrack, roughly 1 in 7 people in North America will experience depression in a clinical sense at some point in their lives. Now, 1 in 7 means that the odds are you know someone who will or has or is experiencing clinical depression, which I think it puts it in light that people need to know about these disorders and need to know how it impacts the community that they're in. So there are different types of depression. And the most common, potentially in some ways the most severe, is major depressive disorder or clinical depression, is kind of a gross name. And basically, major depressive disorder, it comes with feelings that'll last for at least 2 weeks of feeling worthless, feeling like a burden, feeling an excessive and seemingly disproportionate amount of guilt, extremes in diet, either eating very little or eating an excessive amount of comfort foods, sudden weight loss or weight gain, a change in appetite, or sorry, change in sleep patterns such that either you sleep way too much or sleep way too little. So unhealthy sleep hygiene that is acutely set um, in the depressive episode. And major depressive disorder, and many have this, but it cannot be overstated, also comes with feelings of suicidal ideation. Now, to be clear, not all suicidal feelings mean an individual wants to die, but rather they may feel they don't have an out or a mechanism to address the problem they're facing. And suicide is essentially an ultimate out that an individual controls. So it can represent control over a problem that where they don't see another solution. It can represent an escape. Often when people decide that they're going to follow through with suicide, there's almost like a giddy, euphoric feeling like all my problems are over. And also sometimes, not so much with depression, but sometimes people engage with suicidal thinking because they want to assuage feelings of abandonment. Like no one really cares about me. so I'm going to end it, and then people respond. Um, but I digress back to major depressive disorder. Suicidal feelings are quite common, and people need to reach for help when there is an intent, when there's a lack of future focus, when there's planning, and there's means to execute the plan. Certainly, individuals can reach out for help beforehand, but those four states that I pointed to are major red flags for suicide, and suicidal feelings are a major part of major depressive disorder. So just to be aware of that. And there's persistent depressive disorder, which is generally feelings that are not quite as severe as major depressive disorder, but they last for a long period of time. Around 2 years would be the diagnostic criteria. And basically it is less acute than major depressive disorder and less episodic. People who have major depressive disorder will go through periods of even months, um, but the diagnostic criteria is 2 weeks of feeling those intense feelings. Persistent depressive disorder, individuals will have those feelings for in a less intense fashion, but for longer periods of time. Disruptive mood dysregulation disorder, basically the individuals will, and this is one that can be diagnosed in children, often manifests in people who just before puberty and then adolescence. And basically, there's intense anger associated with trying to deflect intense sadness and lots of angry behavioral outbursts. It's a depressive disorder, but also, I mean, I would caution people because it can be symptomatic of many, many other things that young children and adolescents can face. And then there's premenstrual dysphoric disorder, which is related for individuals who are menstruating, um, associated with anxiety, irritability, and depressive feelings. And basically, this is a clinical condition that can be treated. And one of the assumptions, especially for women's mental health or the mental health for those who menstruate, is a normalizing of, well, this is just how you feel, get over it. But no, this is a condition that can be treated. And frankly, people don't need to live in misery. So if this is a condition someone has, I would recommend they engage in treatment. And then there's also uh, post-event, sometimes postpartum type disorders would fall into this category. So postpartum is perhaps the most common, where there's a major event in someone's life where there's been a lot of buildup, a lot of anticipation, and then the event happens. And then afterwards, individuals will feel feelings of worthlessness, feelings of kind of a listlessness or a lack of motivation or lack of ability to engage with the outside world. And so, again, this is something that can be treated. And people shouldn't have to, even if it can be normalized, people shouldn't have to engage in such a way that they're expected to feel this way. There are other few things that seasonal affective disorder is a type of depression, and basically human beings need vitamin D. People with fairer skin, like, I mean, my paternal family's from Norway, so I have fairer skin, are less able to absorb vitamin D and can be impacted by not being outside as much. And certainly this affects all skin tones, just people with fairer skin are more prone to it. And basically, in the winter, when there's less sunlight and being outside is less accessible, people can have seasonal affective disorder, which is depressive features associated with winter weather. And then there's various atypical types of depression, and it can, I mean, all of them can be treated, but there are types of depression that are related to maybe something that's highly individualized to someone, like a world event in the other side of the world impacts someone in a way that is depressive. Now, I want to preface, after talking about these different types of depressive disorders, um, when one's basic needs are not met, if someone's housing is precarious, if one's food sources are precarious, if one doesn't have, proper clothing, or if one is living in an environment where they might have that and might not, but their secondary primal needs like love, community, identity, purpose aren't met, that can feature depressive type feelings. However, and certainly some treatments for depression would be helpful in those situations, but frankly, procuring and securing basic needs and then secondary primal needs are are incredibly important. And if people don't have those in their lives, of course they're going to feel depressed. So people experiencing extreme poverty or not appropriate housing, or people surviving war zones, or people in very, socially unstable situations, there will be depressive features. And it's not always clinical depression. Sometimes it's circumstance, and it's a normal human reaction to react to that circumstances in a way that looks like depression. Now, there are other health conditions that can be impacted by depressive features. People with chronic depression are more prone to Parkinson's and Alzheimer's and dementia. People with depression are more prone to stroke and multiple sclerosis. Seizure disorders are also more common to people with depression, cancer, and chronic pain. Now, there isn't always a direct link, but basically, in your endocrine system, if you are depressed, you are more likely to be subject to a lot of diseases that human beings experience. Now, in a general sense, I kind of went over the specific disorders, but a general sense, depression looks like this. And I think that it is very pragmatic for people to know these symptoms. But extended periods of time in which feels very sad or hopeless or worried. In some people, particularly younger people, irritability replaces the sadness, hopelessness, and worry. And then a key feature is not enjoying things that historically used to bring an individual joy. That is a strong feature of depression. Um, Easy irritation, easy confusion, trouble following information or events, or sometimes someone who's experiencing a major depressive episode might not follow a conversation and ask for things to be repeated, not because they weren't listening, but because their brain is not capable of absorbing the information due to the depressive features. Again, extremes in diet, either eating way too much or way too little, and the subsequent weight loss or weight gain associated with that. Sleep, either being hypersomniac or insomniac, so sleeping way more than is required and is healthy, or sleeping far too little. A major feature is low energy and fatigue, and this is where a moralization of the disorder can come. It's like, well, get out of bed and do something, you'll feel better. Individual with depression really struggles to do that, and it seems like an insurmountable task. Difficulty concentrating and remembering things, as per what I talked about earlier about not remembering conversations or following conversations. Physical symptoms, headache, stomach ache, or even sexual dysfunction can be associated with depression. I want to be clear, these are highly individualized symptoms. Not everyone experiences all the symptoms. And then again, thoughts of self-harm or suicide. To be clear, self-harm and suicide are very different. Self-harm is causing injury, such there's an adrenal response and adrenaline comes, so it relieves mental health symptoms. So people who cut aren't necessarily trying to end their life, but rather they're trying to stimulate their central nervous system. So there's an adrenal response and they don't feel the emotional pain that they might be feeling. And then suicidality is a want to end your life, obviously. And yeah, needs to be responded to as such. Now, what causes depression? There is not any sort of distinct known cause. Some of it is just inherent brain chemistry, um, and basically an imbalance of neurotransmitters surrounding serotonin and dopamine can contribute to depression. Um, Grandparents, siblings, parents, if they have depressive features, there is a strong hereditary component as well. And then stressful life events, death of a loved one, as mentioned before, it's natural to feel depressed, but that can also trigger a clinical depression that needs significant treatment in an individual as well. And then medical conditions, especially chronic pain. Your body wasn't meant to always be in pain, and sometimes the response is depressive thought patterns and even clinical depression. And then some medications can cause depression, um, and in particular substances um, that are sedatives to your central nervous system. So alcohol is the most commonly used sedative, and there's a definite link between chronic alcohol use or misuse and depressive features. And then there are other benzodiazepines they slow down your central nervous system. Opioids slow down your central nervous system as well, although alcohol is most commonly used and misused of the three substances. But anything that slows down your central nervous system can cause depression. And then cannabis actually exists in a middle ground where it has stimulant effects and it has depressive effects and it has hallucinogenic effects. And there are links, especially in CBT heavy strands of cannabis, that are related to depression and a causal agent of depression. Now, um, I'm not going to go too much into the diagnostic criteria for a couple reasons. One of which is when individuals learn about a mental health disorder, it is very likely that you're going to be like, um, you're going to diagnose yourself as having this. And, there's this dialogue for people who Google mental health disorders, everything is cancer. And the reality is that a little bit of information can be a little bit of a dangerous thing. Not everyone has clinical depression. And if you think you do, it is very important that you go to your doctor or a mental health professional and explore diagnostic tools and treatment. Please don't self-diagnose because there's a lot of inherent errors in self-diagnostic attempts. Um, so if you feel you have depression, if you feel you have those longitudinal symptoms that I've described, please go to a doctor and a medical professional. Now, treatment. Um, there's two basic strands of treatment that are often used concurrently for depressive episodes. Psychotherapy being one, typically talk therapy involves talking to a mental health professional, and they can use different modalities, in particular cognitive behavioral therapy, but there's other modalities as well. Is the most common. And basically, CBT or cognitive behavioral therapy allows you to kind of change your relationship with your thoughts and take more agency over where your thoughts might be going. Is kind of the Reader's Digest version. And also think of your thoughts and your feelings on a macro level. So in other words, from above, such that, if the analog was your brain and thoughts and feelings are an engine, you're not just looking at the carburetor, you're looking at the whole engine in unison, such that that gives you more of an understanding of where they fit in the bigger picture. And then medication. And there's different types of medications, often used as referred to as antidepressants. Most commonly prescribed is citalopram or escitalopram, and there's other medications as well. I don't necessarily want to go deeply into the physiology of the medications, but I do want to say that oftentimes medications are highly stigmatized, and that's often based upon incomplete knowledge of how depression works. And sometimes there is a chemical imbalance in the brain where someone's brain is just wired differently enough that they're prone to depression. And the amount of relief and the amount of, frankly, improvement in quality of life that can be associated with using medication to treat that is not anything to be discounted. So um, that that is something to keep in mind when speaking about medication. And again, a lot of this I would recommend talking to a medical professional and a mental health professional before you pursue or explore further feelings. And there's a lot of things too that can be considered complementary. Um, there's a lot of indigenous and Eastern philosophies associated with the treatment of whole body systems that have some evidence for treating depression well. Acupuncture, for instance, hypnosis, massage, all of those things cause your body and your central nervous system to respond in a way that is helpful to depression. And just because it's outside of the Western scope does not mean it should be discounted. Um, and in extreme cases, brain stimulation that can be the most common is probably ECT or electroconvulsive therapy can be used. However, that is a very invasive procedure. So again, I would only engage with that with help of a mental health professional. Now, one can think of depression in a preventative sense as well. That's not to say one would never get depression. Life can be hard sometimes. And if you're prone to depression or if that hardship is prolonged, clinical depressive features can arise and they should be treated as such. But um, there are things that are kind of can be considered mental health flossing that are very helpful for depression. Regular exercise, defined by the individual. You're not going to tell a marathon runner to walk around the block, but you're not going to tell a couch-bound person to train for a marathon. But regular exercise relative to one's capacity and interest is very good for depression. Getting quality sleep of the appropriate number. If you're sleeping more than 9 hours a day, that might be um, hyposomnia, which is causes a lot of health problems and also eats up your day. And if you're sleeping less than, I would say, 6 hours on a regular basis, or have a great difficulty falling asleep, that's something to be managed. And getting regular healthy sleep is very good to safeguard you against depression. Eating a healthy diet, and there's no one way to eat healthy, contrary to whatever you know whatever diet guru might be selling. There's many, many ways, culturally appropriate, individually appropriate ways to eat that are healthy, but a healthy diet is a safeguard against depression. Avoiding depressive substances, in particular alcohol, is a safeguard against depression. And they slow down your central nervous system, cause a lot of disruptions to sleep and diet and exercise, and are they cause depression and anxiety and a whole slew of mental health and physical conditions. So avoiding alcohol would be a good thing to safeguard against depression. And then spending time with loved ones, doing loved activities, spending time outside. Human beings need love. There's this narrative of us being independent cowboys that is prevalent in some places in the West that really is contrary to the human condition. We need to be around loved ones, be it community, be it family, be it romantic partner, even loved colleagues in a sense. And those are all things that safeguard against depression. So if one feels depressed, I think the most powerful message you can do is, tell them you don't have to live this way if you don't want to, and be willing to listen, and then advise people to talk to professionals who treat depression. 1 in 7 people roughly experience it. Women are more likely to seek help than men for various reasons, and living in a better way is possible. So yeah, that's what I have on depression.
Thank you so much, Ernest, for this fruitful presentation on depression. It's something really need to be taken into consideration. And whenever, as you said, someone feels that there is some sort of symptoms, some red flags, always seek the proper help from professionals.
Absolutely. This is not something that you can moralize or shame someone into changing, and it's something that must be addressed professionally.
So I've just got one question. So
Yes.
how we can identify or recognize depression and just and find it different than the normal sadness. As you know, life is goes up down, so it's not always on a regular rhythm. So sometimes we feel sad, sometimes we feel that deep sadness, sometimes we are affected or impacted by what we see, what we read, what we thought of. So how we can just what is the line between depression and sadness?
It's really, there's not a finite line. It's duration and impact on life. It would be the answer, but that's not a fixed line. Um, People who have individually gone in and out of major depressive features may be able to tell they're entering one 2 days in, and therefore seek treatment. Um, However, someone who experiences a loss of a loved one may feel, a loss of a romantic partner, loss of a child, loss of a parent, a close, intimate, loving relationship, if healthy. Um, they may feel very down for months, and it wouldn't necessarily be clinical depression. However, the treatment that impacts clinical depression and would impact this bereavement type feelings of depression is the same. So there's no harm in seeking help. And in a sense, um, and I don't want to say it doesn't matter, but in a sense, in terms of a treatment lens, the difference is minimal. So if you feel down, it's okay to seek help.
Thank you so much, Ernest. And at the end of this information session, I would like to thank you for the time and effort you have dedicated for us. Thank you so much, Ernest Johansson, and for everyone else. Stay safe, stay well, cheer yourself up. Life is good, and we are looking forward to see you at another session with Rights and Responsibilities Awareness Initiative. Thank you, everyone.